Jeremy, thank you so much for saying you'd arrange a meeting to speak to me. As you know, I'm the new MP for Batley and Spen, but I just need to say to you that everywhere I go, everyone I speak to, in my surgeries, people are saying we're concerned about the downgrade of Dewsbury Hospital. Pinderfields is so far for us, and if this happens to Huddersfield as well, we're going to be an area the size of Liverpool without A&E and a dedicated A&E for the people of Batley and Spen. Please, please listen to the people. We are people, not numbers.
Under no circumstances must you make patients who are already stressed to death, practically, to go to Pinderfields, which is much further away. It's all very well if you have a car and can whiz everywhere, but an emergency ambulance got me to Dewsbury very quick, and I was really well looked after at Dewsbury. For heaven's sake, please don't close Dewsbury.
I was booked in for an induction at Dewsbury Hospital. Day after day of phoning, they told me there was no beds available.
I have been attending Dewsbury Dermatology Department since 1998. At the time when I first went, there were 4 consultants. My consultant was a Mrs. Taylor. In 2010, they reduced it to 2 consultants, and since then the service went down. And in 2015 it was reduced to no consultants. The only people that are there now are nurses. They cannot even give me the medication that I need.
My child has a potentially life-threatening medical condition whereby at times he may need urgent care. I'm petrified with the changes at Dewsbury. He won't get the care that he needs. We are people, not numbers.
As somebody who lives in Dewsbury and works in Batley, and I have done now for over 20 years, I'm really concerned about the plans for our local hospital. Dewsbury Hospital provides a really valuable service for local people. This is a big catchment area, and if you take away our emergency services and our important medical treatment services from this hospital, what are local people supposed to do? There are a lot of people in this area who are on low incomes, and they're going to find it very difficult to travel over to Wakefield or wherever they may need to go. You're going to have people who have a situation where it doesn't require an ambulance, but they don't have the money for a taxi, or they don't have alternative transport available. And what are these people supposed to do?
I've been in Pinderfields Hospital in the recent past. At the beginning of this year, I was in there with a major operation. My family had to travel from Batley, some having to catch 3 buses to visit me. And that caused a lot of stress to them and obviously to me, and it affected my recovery.
My daughter has had to go to Pinderfields to have a new baby because there is no consultant at Dewsbury anymore. And when the baby was born, within the first few weeks, he was rushed to Dewsbury Hospital because he was stopping breathing. And after spending some time at Dewsbury, again, they can't look after a poorly baby overnight, and he had to go to Pinderfields again. So for the people who live around here, please don't close Dewsbury Hospital.
I work in the NHS. I know just how stressed and under pressure the NHS service is. And every day we as nurses, as health professionals, we see how people are really anxious, really worried about what they're going to do once the services in Dewsbury are cut. We have to deal with those anxieties, and cutting the provision at Dewsbury isn't going to help anybody. We are people, not numbers.